Welcome to The Government Mechanic. This is Season 4, Fixing America. This is Episode 43, where my special guest and I are going to talk about the VA plan that I proposed after many, many years of talking about issues related to veterans and real solutions. My guest today is Steve Sanson. He is a co-founder and currently president of Veterans in Politics International from signing in from Las Vegas, Nevada. Hi, Steve.
Hi, how you doing, Dr. Lin Khan? Thank you so much for having me.
Um, so Steve and I have been talking about veterans issues for like more than 10 years. We met 10 years ago when I was an independent candidate for president wandering around the country, and Steve invited me to talk to his group that was vetting candidates.
Yes.
Veterans in Politics International, and we've been talking about these issues ever since.
Yes.
In episode 42, I talked about clusters of veterans issues and those related to how the VA functions. And there were groups of issues, and then I translated them into a strategic plan with 7 strategic goals to match the issues that you, Steve, kind of clustered out for me. So if we could put that graphic up. So when I really thought about what the clusters of problem areas that you identified, Steve, and I put them into a format that fits with the requirements of the federal government in tracking performance, I came up with 7 strategic goals. And let me just list them out, and then you and I can talk about them one by one. I really
Sure.
want to know what you think about kind of the whole thing, but what would go into each of these individually. So, as I've said before, strategic goals, I like to see them on one page, and they have to tell a story. The current VA strategic plan does not tell a story. It's a very convoluted 216 pages. The VA strategic plan is 216 pages, which is like about 200 pages too long.
I think it's 215 pages too long.
Yeah, well, it is. But what I think is really important in a strategic plan is that the first goal has to be the essence of the mission of that department. So that's why I put deliver benefits, care, and services first. And I thought it would be important to call out the issues of veteran suicide and veteran homelessness, which sometimes get buried in reports. And as goal number 4, the only way to do that is build real partnerships, which government doesn't do particularly effectively. And then the 5th goal is eliminate wait time. So all of those delays for veterans to get their benefits, get decisions on appeals, find out what they're entitled to, there should be zero wait time. As you, Steve, have pointed out, we have the artificial intelligence capability to have medical issues and medical records transition immediately from the Department of Defense or Department of War.
Well, the current president passed some type of legislation saying that if a veteran has to wait more than 30 days for a VA doctor, they automatically could go on the community care program, which means that they go and see a civilian doctor within their neighborhood, within their zip code. So that was a plus, and that helped out a lot.
And has that been working out?
Oh yeah, that's been working out. That's been working. It cuts down on a lot of delays and wait time and stuff like that. So yes, I use it myself. So I personally know that it works.
And so now let's get to the next 2 goals that come from conversations that you and I have had, which is setting national standards and then publishing facility scorecards. So you might be able to access civilian medical support within 30 days or after 30 days. Is that true at every facility? We don't know, do we?
No, we don't. But especially the rural areas, that doesn't have a lot of population. Those veterans have to drive for miles and miles and miles to get any type of care. They
Yes.
need a lot more of these clinics in the rural areas of our country. Yeah.
Yes. Well, I'm in the rural America. I'm in the mountains of upstate New York, and I'm driving literally 400 miles to go see a specialist like
See,
2
that's
weeks.
what I'm
So
talking
yeah,
about.
no, it's absolutely true. I mean, my
Or at
town
least
has a
a
good little clinic.
yeah, at least a
Absolutely
mobile
true.
service, a mobile van comes and pull up in front of their home if they don't want the veteran to drive those 300 miles.
Yep.
Maybe some
Yep.
type of mobile service to come to them, or some type of home doctor. Make home visits.
I think that's why I
So,
put builds partnerships, because the government, they don't seem to recognize the resources that are out there in veterans
mhm.
organizations. They're not necessarily connected to government, like Veterans in Politics International and your veterans courts, or Iraq and Afghanistan Veterans of America,
Right,
or Wounded Warriors.
right.
So we should be the government funding should support community-based organizations that help veterans. And I don't think we do a very good job of that.
Yeah. Well, a lot of these community-based organizations don't ask for government funding too. So there's no way the government would know that they're out there unless the state provides them some type of information when they file with the Nevada Secretary of State to create that nonprofit. Other than
I
that, the
think
government won't know.
I think they well, I think some people I think they know, well, some people know. I think some people know, but they're not doing that outreach. I mean, even Wounded Warriors. Why doesn't the government support that organization?
Yeah. Well,
I mean,
there
why
was
did they don't
a
need to be asked, just support
right,
that organization.
right, and you're absolutely right. But there was some scuttlebutt a few years ago about the Wounded Warriors. There was some information saying that the executive members was taking monies, so that was a problem. This was a few years back. I'm sure that they changed their whole makeup on how they do things and how they run business, but sometimes when you hear things like that, you kind of yield yourself back from wanting to donate. Make sense?
Yeah, yeah. But when I look at, like the kinds of community-based organizations that, for example, support kids who've been involved in the justice system or have been arrested.
Right, like
Um,
Casa.
well, all of them, yeah. I mean, they're
Yeah,
all over the
yeah,
country. Crime is going down, juvenile crime is going down. A lot of it is because that network of people delivering services has figured out a few things, and they reach out to community-based organizations and they create community-based organizations. And that doesn't seem to be happening with the VA.
yeah. You're
Reaching
right.
out and leveraging the support of people who have experience helping veterans, especially around suicide and homeless issues.
Yes. Oh,
So,
homelessness is a whole different issue, Dr. Khan, because that involves some of some band-aids that veteran uses, which is alcohol and drugs to get through their day night terrors. And
yep,
some of it is mental illness, from traumatic brain injury to PTSD. The kinds of theater that they saw in combat, it would just some of them just go homeless just because of that, because
yep,
they just gave up on life.
yep,
So you have to reach the core issues, which would probably be mental illness and addiction. And if we could conquer those two issues, I think that there would be less. I think it would cut it by 90 something percent homeless problems with veterans if they conquer those two issues. Veterans when they're in the military, they have a mission, they have a purpose, right? And then when they get out, the purpose is taken away from them. So they have nothing to, in some veterans' minds, live for the next day. You got to give them purpose. You got to give them something that they want to live for. You know. Like some of them, they're service animals. They live for their service animals because that's their friend, and they don't want to go away. And it
Yep.
depends on the veteran. Each veteran has a whole set of unique issues and a unique mindset on how they view the world.
I didn't say it was easy. I mean, it's a complicated issue. It's just as a strategic planner, I don't like seeing it get buried. And that's why I pulled it out to be its own strategic goal. So we could really start looking at what works and what's not working
Right.
and do what works, which,
So my belief on that, if you conquer the mental illness and the addiction, the only veterans should be on the street are the ones that want to be there, because there's some veterans that just want to be there. They don't, and that's hard to say. Maybe that's
yeah.
part of a mental illness all by itself, but some veterans don't want nothing to do with government. They just want to feel like they live off the land, like Rambo in First Blood. They want to travel from one city to the next. They just want to walk America, so to speak, and they don't want to they don't want to have anywhere that they call home except for United States. They'll say United States is my home, but they won't say Cincinnati or Boston or Las Vegas or
Yeah.
Michigan. They won't name a state or a city. They'll just say the country, because they're like nomads, just walking. And
Yeah.
that would be a very small percentage of veterans. So, but the majority in the '90s is addiction and mental illness, and then there's the economy too. So,
Yeah.
there was a veteran in Florida. Let me tell you the story. There was a veteran in Florida that was homeless for years. It was in the paper, and somebody found him and went to go see if he had his benefits, his VA benefits. Found out he had over $300,000 in his bank account, because he claimed disability and it was 100%. And somewhere along the line, he forgot all about it, didn't know.
Wow.
And he became homeless, right? Because he forgot all about it. So while he was on the street, the money, direct deposit,
Kept,
just keep going in his
oh my
account.
God.
They had no idea.
How did it
They,
turn out?
Great. They bought him a house, or he bought himself a house. They took care of him, and the money was coming in every month. It's not like it stopped. It was just a
Hmm.
continuous thing. But so mental illness is a great problem in some veterans.
And I think part of what you just said is that it's one-on-one. Each person is unique. So each
Yes.
individual veteran has their own individual needs and preferences and priorities. And we've talked about this before. Just system needs to listen to individual veterans to understand what the issues are and what the right path forward is, and where
And
that's
sometimes it's more than just being in the military. Sometimes it could be some family stuff that triggered it. Maybe a member of the family passed away. It could be anything. So that's another thing that could factor in. Sorry for cutting you off,
so
Dr. Khan.
no. So one of the things I'm saying, I think so we've lost, I think, I forgot what the number is, maybe 15,000 medical staff have been eliminated from the Department of Veterans Affairs. So we're talking about needing probably 20 to 25,000 more medical, mental health, homeless, addiction, other kinds of support services. So there's a vast need to add more people with clinical skills to the system.
What I'm thinking, and I'm not privy to any of these documents, but what I'm thinking is that once they opened up the community care and they involved the civilian population to provide medical assistance to our veterans within their zip code, I think they had no need for some of those other medical folks that was on the VA, because they're pushing everything out to the civilian population and not putting it in, veteran a hospital. They're pushing it out, Instead of going
Oh,
to the VA hospital for radiation, you're going to go to Steinberg Diagnostics, which is 2 blocks from you for the radiation treatment. So I think that's what's happening. But, I don't know for sure, but that's the only thing that would make sense to me. Reason why they're cutting all these medical folks in the VAs, because they're pushing everything out to the civilian population. That's the only thing that would make sense to me. I'm just playing devil's
do,
advocate, Doc.
yeah, no, that's fine. That's fine. No, I think it's a great issue, and I don't know the answer. I don't know what how many people have been let go versus how many people are moved towards
Right.
community-based services and medical support. But all right, so let's just go back to this plan. When you look at that graphic,
Mm-hmm.
what makes sense? What works? What doesn't work? What would you change?
I wouldn't change anything. I wouldn't change anything. I would be more specific as far as when we talk about deliver benefits, care, and services. What? Okay, so that's the title. So what's specific? How are we going to go
Yeah.
about doing that?
Yep.
Are we going to get
Yep.
AI assistance? Or are we going to expand same-day access to primary care and urgent care services? Are we going to create a single veteran portal for claims, appointments, and prescriptions and records? Or are we going to increase staffing and claims that's edu- edu- education and specialty medical services? So, I mean, each of them have a title, okay,
And
but how are we going to accomplish that title?
each one, absolutely.
Yes.
Yes. So there's actions underneath, and then
Right.
there's
Right.
who's accountable and what's the timeline and what are the specific actions and strategies that cover each one. I just wanted to start with well, here's the big picture. There's
Right.
another thing that I think is important to put in there is so the PACT Act said that veterans who have a certain list of symptoms or illnesses that also served in areas where there are toxic chemicals do not have to prove that their service is connected to the symptoms. It's presumed that if they served during the Vietnam War and have symptoms related to Agent Orange, they don't have to prove it anymore. They just get their benefits. And I think
That's
we need
good.
to expand that
Right.
so that veterans are not having to prove over and over again that their experience on the battlefield led to certain symptoms.
Right.
So
I
I
think as
think
long as
there are
they were in
policies.
country, right. I think as long as they were in country, they should be able to get it. I mean, they're there.
Yep, yep,
It's not like they're in LA, and want the benefits. No, they're in Saudi Arabia, they're in Kuwait, they're in Pakistan, they're in Afghanistan. As long as they're in country, they should get it regardless. Because it
and
takes a
time.
lot of time to figure out who's who, who's what, where they're on the border, where they by the DMZ, where they over here by the flight line. Come on, let's not get picky about it,
Oh,
because even if you're on the flight
oh,
line, you're jumping in a truck and you're going to the DMZ. You know what I mean?
yep, yeah, yeah. No,
So
good
you're
point.
moving
Good
in that
point.
country regardless of where in the country you are. But you know what, you're asking, what would I add to that list? And I was thinking about a few other things. And how about modernizing the VA claims process as number 8, because you have 7 on there, right? How about
Well, go
number
ahead.
9, expanding mental health and PTSD TBI treatment if they go specifically, 10, improving rural veteran access is something that I mentioned, because people that are in rural communities have to go for miles, right?
Yep.
And 11, support veteran employment and uh what was that word I was looking? Entrepreneurism, right? Because there's a lot of veterans out there that can't work for anybody. That's a serious thing. They
Yep.
just cannot work for anybody. They have to march to their own drum, and
Wow.
and and
Interesting.
and and
Yeah.
and that's what it is, because I mean, that's how they teach you in the Marine Corps. in the Marine Corps, you're supposed to know, if you're out there patrolling, you're supposed to know everybody's job. You're supposed to know the lead point man. You're supposed to know the rifleman. You're supposed to know the guy that's on the radio. You're supposed to know the navigator. You're supposed to know everybody's job, because if one goes down, somebody needs to take charge. So entrepreneurism should be a huge factor for veterans, because veterans are what? Leaders. And if you have the terminology being a leader, why do you want to follow anybody? Because that's not your style. That's not how this country trained us to be. They trained us to be leaders, not followers. And supporting veteran employment, entrepreneurism should be a huge factor, along with supporting military families and caregivers, right? That should be
Yep.
number 12, because the families play a huge role. I mean, look at you. You're the daughter of a veteran, right? So a
Yep.
huge role the family members play. They cry, they sympathize, they watch, they grieve. They feel all those emotions. Not as much as the veterans, because they're feeling pain, but they also have a different type of pain, And 13 should be increasing accountability and transparency, because we need a lot of accountability and transparency, especially when it comes to VA. When you're dealing with billions and billions and billions of dollars, of taxpayer dollars, being funneled into this institution, and you have no accountability and transparency,
Transparency. Yep.
that's huge. There should be some type of forensic audit to begin with. And when Donald Trump did that Doge thing, I was like, oh my God, I knew there was wasteful spending. But who spends $400 for a $5 hammer at Lowe's? Who does that? Who does that? Where is
Department
this
of
money
the U.S.
going?
government, Department of
You
Defense does
know?
that too. Yep.
Right? And the
Yep.
14 should be improve transition from military to civilian life. Why that's important? Because military members, they come out of the military and all of a sudden they are lost. What they should do is have some type of transition program to civilian
Yep.
life. Teach them how to apply for a job, how to interview for a job, how to fill out stuff online, how to get their medical benefits, their disability benefits, get it streamlined, so when they come out of the military, they're not all lost. And people go, did you file for your disability benefits yet? And it's been 15 years. No, what is that? You know what I mean? They need to have a program within all 5 branches of the military: Air Force, Space Force, Coast Guard, Navy, Army, Marine Corps. I hope I got them all. But
Yeah.
because, they added that Space Force, a couple years back. They should have some type of transition and program, which they don't have. I think the only branch of the military that have some type of transition program would be the Air Force. All the other branches, no. I know the Marine Corps certainly does not. I mean, because you have no idea what your benefits are. Even today, I've been out of the Marine Corps since 1991. I've been out of the Army since 1998. I still don't know what all my benefits are. I have no idea. Some people didn't know the difference between a GI loan and a vocational loan, or a Chapter 35 means your total disabled benefits, that your kids could go to school and your spouse could go. They have no concept of that. So they need to have some type of transition to civilian life, along with how to do your benefits when you're a civilian. So when you get out, you're good to go. Not getting out and wait 15, 20 years later and still don't know what your benefits are. Here's number 16. Combat fraud, waste, and abuse,
What
because
does
there's
that
a
mean?
lot of that. Fraud, waste, and abuse. There are tons of that. So when you were talking about those staff, that was medical staff being let go, I'm thinking maybe the reason for that is because of their community care program. Because you don't want to double your efforts, right? We're dealing with taxpayers' money, and if that was my money, my personal money, I sure as heck don't want to, double my efforts when I
Yep.
could get it with
Yep.
$1. I don't want to spend 2. You know what I mean? And then 17 should be established a Veterans Bill of Rights, because
Mm.
there is none. There
Say
needs to
more.
be
Say more. What would be in it?
guarantee timely access to care, guarantee transparency in wait times and performances, guarantee appeal rights and access to records, which they don't have, protect veterans and retaliation for filing complaints. I remember what's told to me. I was filing a disability claim on something, and the guy that was doing it, the VSO, said to me, "Well, if you file too many complaints, they might reduce your current disability benefits because now they're investigating you some more." I'm like, "What type of crap is that?" And why is he telling me that? Because he's telling me that because he doesn't want to do the typing. He's trying to discourage me from filing a rightful claim that I should file. It's up to the VA administration to say that claim is no good. But he's telling me that, hey, if you file too many claims, you're at a risk of losing your current benefits.
Wow.
Let's say you're at 70% and you want to get to 100, right? Because once you hit 100%, that's the world. You get free, you get dental, you don't pay any copays, you get 100% coverage, you get a license plate, depends on what state you are, you get a licensed disabled veteran plates on your vehicle, you could park anywhere in the city's jurisdiction or the airport, you can leave your vehicle in the airport for months and months and months and come back and you pay nothing. These are the benefits of 100% disabled a veteran versus a 70 or 80 or a 90%. And another thing with 100% service connected disabled veterans, they need to establish a dental program for all veterans, no matter what their percentage is. Because right now, it only applies to veterans that are 100%. They get free dental, yes. If you're under 100%, if you're 99%, which they don't have, I think they go in tens. But if you're 90%, you don't get it. You don't get dental.
Wow.
Anything less than 100. And I think it's a crying shame because if you have some type of problems, gum disease, or some type of cavity, root canal that you need, it affects you. It could go into your blood system and affects your heart and affects your brain. So it is a medical problem. But they don't have that for veterans. They don't have no dental for veterans that are under 100% disabled.
Wow.
And another thing, when you're 100% disabled versus 90% disabled, your pay doubles. So let's say you're getting $2,000 being 90%. Right? Which is only 10% from 100. Once you hit that 100% threshold, you're now getting $4,000 a month. I don't know how they did the math, but that's how it works.
Wow. All right. Anything else on your list there?
No, I got 17 now.
Okay. All right. So you've given me a lot to think about. I think I have to add a few more, reword these. And I think part of what you're talking about are strategies that go under these goals.
Right.
That would show this is how we're going to do it. So thank you. Now I have weeks more work. So that was my version of accountability, kind of.
Like requiring annual audits. I think that should be something. And you know what? I think these audits and all these things that they find, I think it should be a public record. I think that everybody should know what's going on because taxpayers' dollars is what's funding the VA. It's not being funded by a private organization. But yeah, implement uniform quality standards across every VA medical center and clinic. It should be the same standards no matter where you go.
Yeah.
That way the veteran won't get confused. If a veteran moves from California and I was living in New York and the standards have changed, they're like, what the hell? Now they got to get used to that. And veterans don't want to get used to new things all the time. If this is the way it goes in California, this is the way it's supposed to go everywhere because it goes, it's the government. The government didn't change. What changed? Different state, but it's a government-run facility. Why should it be any different? And that's why they get frustrated. And I don't blame them because I get frustrated too.
What kinds of things should be on that facility scorecard? What should be measured? What should be public? What measures should be made public on a scorecard?
Required annual audits, development, national benchmarks for patient outcomes, and veterans should be able to go in on a site and give their opinions. Just like we have Yelp and all
Yep.
these different things out there. They should be able to give their opinion. And you know what? If a veteran gives their opinion and they feel that they have accomplished something, they feel like there's a possibility they're going to be heard. So
Mm-hmm.
all they want to do is be heard. Did you see what happened in Iran when they went down there? That F-15 that got shot
Yep.
down, and
And
they
they went
got
and got him.
one pilot, and and the other pilot had a broken leg, and he went up the mountain, and they went and they
They got him.
eliminated all the enemy for that one guy. That's the America I love. That's the America I love. A strong America. You take one of our veterans or military or American citizens, even a civilian citizen, you take out that entire country.
I'm not sure I'm
That
quite
way,
there yet.
nobody
But...
will mess with us, Dr. Khan. Because
All
we're the
right,
land
Mr.
of the free.
Sanson.
We are the land of the free. We're the home of the brave. And we should respect that motto and make sure that motto is echoed from one side of the globe to the other. And then when those ET people come here, they're going to know it too.
Dear, thank you, thank you, thank you. I can
Absolutely.
see I have a lot more work, and I will send you the next version.
Well, Dr.
So,
Khan, it's been an
thank you.
enjoyable
Yes.
55 minutes with you right now, going on 56.
Yep.
And I want to thank you
And
for this opportunity. You have always been a scholar and a champion for veterans, and I really appreciate what you do. Thank you so much.
well, and I appreciate your service to our country. Thank you, sir.
Thank you, Dr. Khan.